Over a period of 12 months, the Clarity Project brought researchers and members of the public from across the UK together in new ways. We aim to create different ways of doing public health research. The Clarity Project was funded by the National Institute for Health and Care Research, School for Public Health Research. It has listened to those who face the most exclusion in society in order to consider ways in which public health issues can be addressed. This included people with learning disabilities, racially minoritized communities, people leaving the criminal justice system, and people living in deprived rural and coastal communities. We worked hard to ensure that we worked in ways which fit in with and supported marginalised community members and organisations.
Challenged our intention, challenged what the impact of the work would be and the likes, and then they had their own kind of priority, and which the representative communicated with me, and then even though it was not really the aim of the project, but I felt like in terms of creating and building that partnership and forming the partnership is something that we could support, so I helped them to organise what they want.
Today when we talked about what topic we'd talk about, what the research proposal was going to be, and then the second day was deciding on a research question, so this was all about belonging we chose. The thing that really stood out for me for the whole experience was all the people who came had lived experience, so it was really nice to see their opinions valued and taken into consideration.
Through this program, then I tried to participate in the draft of the agreement, the cooperation, and also enhance me, and also make me improve, and also make me to understand more in this new country and this new city. And also benefit to me and also benefit to my communities. I think, in the future, I hope my opinions or the opinion from my groups that can be alert or aware by the local government. I think, it's benefit to everybody.
To come into the community to gain the views, which makes it easier rather than expecting people to travel to them.
Building equitable knowledge partnerships had its challenges, and recognising these is an important part of building strong and honest relationships.
Raising expectations amongst the people that we're working with, because they're really interested and keen, and an amazing bunch of people, and they're ready to take the next step and work with us towards developing some exciting research, but we don't know where this is heading, and obviously academic funding is uncertain, and we're trying to iron out different pathways between us as a team, and just getting the balance right between being excited with the group but managing expectations is something that I'm finding quite tricky.
Because we have involved the unofficial groups in this research project to make it more inclusive, and that was the biggest challenge.
And I would encourage our communities, especially the minority communities, to join the partnership, because this is something that is going to bring our profile to a better level, and also to make people understand the challenges that we face. We have the solutions.
However, there is a sense that the Clarity Project has shifted power from academics to community members.
What excites me is just giving people a voice and making sure their voice gets heard.
It's more of a one-way relationship. That was what happened in the past. But being involved in this, I think it has changed that direction of things. It has really changed in that we are forging a new way that universities are going to work with community centers like us, with the people, because they need us and we need them.
As the conversation developed over about 5 to 10 minutes, I suddenly had this light bulb moment that actually these people had interpreted the question very differently from me, but that actually what they were talking about were the things which were most important to them and their communities. And so I thought, this is what's meant to be happening. The power is shifting and the conversation's being taken in the direction that's important, not the one that I, as the academic, thought it should be.
Through building knowledge partnerships, we have co-created 3 innovative research proposals which tackle priority issues for people from marginalised communities in the UK. These proposals involve people from minority ethnic communities, those living in rural and coastal communities, those who have experience with the criminal justice system, and people with learning disabilities. We really hope that the projects that we have co-developed will go on to have real-world impact on the lives of people from marginalised communities. We'd like to end in the words of one of our community researchers who summarises all of our feelings.
I don't want the research to sit on a shelf.